We've seen data from two trials, PALMIRA and PACE, that looked at continuing palbociclib after progression on palbociclib. We have data from MAINTAIN that looked at switching the CDK4/6 inhibitor to ribociclib. And we have data from postMONARCH that looked at switching CDK4/6 inhibitor to abemaciclib. Now, in the approach where palbociclib was continued after palbociclib, there was no improvement seen in progression-free survival. But in the other two trials, MAINTAIN and postMONARCH, where the CDK4/6 inhibitor was ribociclib or abemaciclib, respectively, we did see a modest progression-free survival benefit. When subgroup analyses were done from these trials, we found that most of the benefit was seen in patients who had endocrine sensitive disease. That means they had been on prior CDK4/6 inhibitor for more than a year, or those who did not have visceral disease. So this approach of continuing CDK4/6 inhibitor I would use in patients who have endocrine sensitive disease, so have been on CDK4/6 inhibitor more than 12 months, or who do not have visceral metastasis, and specifically patients who don't have targetable mutations. In the other patients where there is presence of a targetable mutation, or they have endocrine sensitive endocrine resistant disease, those are the patients I would possibly consider switching therapy.